The healthcare system I've researched and chosen to share, which uses a professional practice model that describes the environment for professional nursing practice, is Mainline Health. Mainline Health is a not-for-profit health system serving portions of Philadelphia and its western suburbs out of a total of 6 facilities and a home health service. Its locations include 4 acute care hospitals with more than 1,000 patient beds. This is in addition to their rehab center, their Center for Drug and Alcohol Recovery, and their home care network. This health system employs more than 2,900 nursing professionals and more than 10,000 employees total. Mainline Health is a multi-specialty physician group with over 150 specialties. Here, I'll just list a few of them. A professional practice model defines the components of nursing practice in a way that brings significance to nurses' daily work. At Mainline Health, they wanted a way to solidify how they collaborate, communicate, and develop themselves as professionals. Mainline Health developed an original professional practice model called Fostering Partnerships, which helps them achieve their superior patient outcomes. This model illustrates that Mainline Health nurses are key partners in providing superior patient care through leadership, collaboration, best practice initiatives, and professional growth to their highest level of performance, so that the nurses are in an environment where they not only produce excellent outcomes along their nursing journey, but have the joy of nursing as part of that journey as well. At Mainline Health, this professional practice model unifies nursing practice throughout the system. The partnerships in their professional practice model, Fostering Partnerships, is a simple acronym that stands for patient safety, accountability, research, teachers, nurses as leaders, exemplary practice, relationships, and superior patient care. The image of the rising sun in the model represents a new day, every day, while the sun itself symbolizes comfort, energy, light, and something that is ever present. Now I'm going to talk about the 5 components of a professional practice model and how Mainline Health incorporates these. The first professional practice model component is professional values. Mainline Health values safety, communication, compassion, diversity, respect, and inclusion, excellence, innovation, integrity, and teamwork and systemness. The second professional practice model component is professional relationships. Mainline Health nurses foster partnerships with each other, physicians, multidisciplinary teams, patients, families, and the greater community to yield excellent outcomes. In addition, their nurses have an exceptionally collaborative relationship with their physicians, who in turn greatly depend upon their nurses' assessments and decision-making. The third professional practice model component is patient care delivery model. Using evidence-based practice and conducting research, Mainline Health nurses elevate quality and patient safety in a dynamic work culture. They believe in putting the patient first, so they listen, counsel, and intercede on the patient's behalf. The fourth component of a professional practice model is management approach. Mainline Health nurses exhibit leadership at all levels of the system. They're executives, managers, educators, staff nurses, and nurse researchers. And in fact, not 1, but 2 of their hospital presidents are nurses. Nurses at Mainline Health serve with distinction in all key clinical areas such as med-surg, OR, ED, NICU, and more. And I think that this is just a great example of how Mainline Health really appreciates and respects their nurses. Compensation and awards is the 5th professional practice model component. Mainline Health offers competitive compensation. They have won the magnet status multiple years in a row. The Daisy Award is an award that nurses receive at Mainline Health, and the GEM Award is available for all staff members. Now for my critique of this professional practice model. I'm a big fan of this model because of its simplicity and breadth of scope. I think it really covers a lot. It's very clear. No one can argue that they don't understand it, and it provides a framework for their nursing practice, and it meets the needs of the healthcare professionals and patients in this healthcare system. It does not provide a basis for delivery of holistic care that I would like for it to, such as including spirituality and cultural differences, although they do have a special program dedicated to LGBTQ inclusion. This model promotes decision-making and changes that involve the patient, family, and interdisciplinary healthcare team. I do think that more attention should be focused on the cultural and ethnic diversity of patients and the specific needs related to excellence in nursing management. I think that as far as the professional practice model goes, the compensation and awards section was definitely lacking some guidance and direction that's expected from a practice model. So that area definitely could use some improvement. But overall, I think that this model is great and really serves to guide nurses in this healthcare system.